Welcome to Arirang Live. It's after 2 p.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the South Korean health authorities on the COVID-19 outbreak. Earlier in the morning, South Korea confirmed 63 new cases for 2 straight days on Saturday. 36 of the new cases are local transmissions, and most of them are from the Seoul metropolitan area. And recent spikes in cases in Daegu City and Gwangju City. Many of these new cases are linked to cluster infection at churches, a senior center, and a door-to-door sales businesses. The briefing has just begun, so let's take a listen.
Let us now begin our regular briefing for July 4th on the COVID-19 response here in South Korea. First of all, we have local infections, a total of 36 new local infections today. And we have 27 new imported cases, adding to a total of 13,030 to date. And a total of 52 more people have been discharged, and a total of 936 people are in quarantine undergoing treatment. We had one more fatality as of yesterday. I extend my deepest condolences to the deceased and the members of the bereaved family. And here are some updates on the new local infections. At an apartment complex in the Gyeonggi-do Uijeongbu City, we have a gym center that saw 4 new cases, and they are the acquaintances and friends of the confirmed case, and a total of 25 have been confirmed to date. And in Gyeonggi-do Anyang City at the Lord Glory Church, we also have one confirmed case who works at an logistics center, and a total of 24 people have been confirmed to date. And next in Daejeon, we also have one academy and private academy for acting in the Daegu City, and we are conducting the diagnostic testings for about 1,500 people, and as of now, we have no additional case. And in Daejeon City, we have confirmed that in relation to unconfirmed case that have been confirmed on July 2nd, we also have 6 more cases being confirmed at a clinical center. And we are conducting the epidemiological investigation as well as the tracing. And related to the Gwangju Gwangnuksa Temple, we have 4 new cases, and a total of 61 cases have been confirmed to date. And as for the newly confirmed cases, they were from the CCC Agape Silver Center. They were the patients residing in that nursing home. And also in Gwangju, Ilgok Central Church, we have 6 more confirmed patients. And we also have confirmed that they are in relation to the Gwangnuksa Temple in the Gwangju City, as well as we are conducting an epidemiological investigation and testing of all the people who have went to the physical services. And the next are some updates on the imported cases. We have 3 from America, 4 from Europe, and 21 from Asia. From them, we have 12 from Kazakhstan and 3 from Pakistan. And in relation to the quarantine measures, at the 11 ports nationwide, we have conducted and confirmed that 154 ships have embarked, and also 70% of them have been carried out with full and extensive on-board quarantine. And starting from next Monday, we would also make sure that all of the people who are offloading from the boats will get tested, and they have been tested as well. And next are the R&D measures for plasma treatment. A total of 274 people have have donated their blood, and about 196 people have already donated their blood plasma samples. And thank you very much for your cooperation, and we also ask for your support going forward. As for the administration of the remdesivir, currently we have been administering the drug for the critical people, and for the 19 patients that have finished the registration process, we have completed the supply to all of the 19 people. And during the weekend, please take precaution at the restaurants, because the restaurants also have high risks of infection, and we ask you to also always comply with the quarantine measures, and please refrain and postpone or cancel any social group gatherings inside enclosed restaurants. And also you need to always wear your face mask and wash your hands and disinfect your hands as well. And when you enter the facility, please wear your face mask, and also use public utensils if you are sharing the plates, and also use your private dishes. And please minimize dialogue and conversation while you are eating, as this could increase the travel of respiratory droplets. And also, when making a phone call inside the restaurants, please remember to wear your face mask and talk on the phone outside. We told you this yesterday, but we also ask the religious communities to take precaution as well during the weekend, because these facilities have high risks of infection. And the KCDC, we note yesterday that yesterday at the National Assembly, the passing of the third supplementary budget also includes the R&D budget for K-quarantine, as well as the budgets for the vaccine and therapeutics. And we will also exert our full efforts to implement these budgets. And this wholesome budget designed for R&D measures will also be used to develop plasma treatments, and also develop platforms for our vaccines, and they will be supplied to the entire clinical stages of these developments as well. Last but not least, we have a few announcements for the public. In relation to the COVID-19, we are longing for a possible effective vaccine. However, we believe that even if we have a vaccine, we need to wait until the effectiveness is proven. And until then, it is very important for us to curb the virus and prohibit the spread of the virus going further. And right now in Korea, after May, we are seeing cluster infections spreading through metropolitan area, Gyeongbuk area, as well as the Gwangju and Jeollanam-do provinces. And we are exerting our full efforts to curb the virus and to test, trace, and also identify the patients at an early stage. However, please note that the COVID-19 spreads very fast, even at with no symptoms, and therefore there are also silent spreaders, and therefore the only way to effectively curb the virus right now is distancing. So ultimately, it all comes down to the level of distancing and the quarantine measures as well, and these are the possible options at hand at each of the countries. Right now, Korea maintains the level 1 of distancing, and this is mandating all of individuals and facilities and public use facilities to carry out their quarantine measures, and they need to be practiced going forward. And yesterday we had a meeting of the Presbyterian Christian meeting, and they said that they will postpone or cancel any of the summer retreats and events. And even at these summer retreats or events, they ask to refrain from having meals together or accommodations. And also, Please note that these religious events are also attended by many people in the senior group, and also there are many people who are working at the nursing hospitals and nursing care centers, so we need to also complete and compliance to strict quarantine measures. And thanks to your leadership and initiative, we will be able to curb the virus going forward. And even at the National Confederation of the Labor Unions, they also have announced measures to postpone and cancel any of the large-scale protests. And thank you very much for your support going forward. And also up until now, many business establishments are also carrying out their workshops or their training center sessions, and however, please note that these gatherings could also be prone to infections, and even on the stages of planning, please note that there could be silent spreaders with no symptoms, and it would be also very advisable to cancel or postpone such gatherings going forward. And it is a given that people with symptoms should refrain from going to these gatherings. And also you need to check for people's health conditions and fever. And also distancing and wearing face masks is a must. And even when you stay together, please make sure that there are no respiratory droplets traveling in the air. And when you dine together, please refrain from engaging in conversations and dialogue. And it is very important that you participate in lowering the risks of infection. Thank you very much.
There you have it. We'll bring you more details on the briefing in our upcoming 6 p.m. regular newscast. Until then, goodbye.